Everybody, we're going to talk about the vessels of the circulatory system. So, I know we've had some technical difficulties, so I'm kind of going back to the old way. I know it's a little harder, but your slides will be uploaded. Once again, I'm sorry. We've been having some issues with our internet keeping up with Screencastify, so hopefully that'll be all good sooner rather than later. So we're going to talk about the vessels, and we're going to do a brief overview. So be sure you're taking the notes that I tell you to, because I'm going to tell you the things I want you to know, okay? So there are three types of vessels. You have arteries, veins, and capillaries. Now there are also thin, smaller arteries that are called arterioles, smaller veins called venules, and then we have our capillaries. Know what an artery is. It is a vessel that transports blood away from the heart. With the exception, if you remember from the heart lecture, with the exception of the pulmonary artery, all other arteries except the pulmonary artery have oxygenated blood. All veins except for the pulmonary vein have deoxygenated blood. And capillaries are a microscopic blood vessel that allow blood and nutrients to exchange carbon dioxide, oxygen, nutrients to exchange in a capillary web. And that's where veins and arteries meet, and all of that's happening. So I don't care that you know this information. I just want you to know from this that all vessels have veins and arteries have three layers. They have an outer layer, a middle layer, and an inner layer. And that the opening at the center of the vessel is called a lumen. I want you to know that the lumen is the hollow part of the vessel. Know that arteries do not have valves, but veins do. So know that both types of vessels have three layers. They have an outer layer, a middle layer, and an inner layer. That the hollow opening is a lumen, and that veins have valves. Arteries do not have valves. And as you can tell by looking at both pictures, arteries are also much thicker than veins. So be sure that you know arteries are thicker than veins. The center opening of the artery is the lumen, and both arteries and veins have three layers. Capillaries, on the other hand, only have one layer of endothelial cells. So remember that capillaries are very thin, fine, microscopic vessels that have one layer of endothelium cells. That way materials can diffuse back and forth into tissues. And as you can tell, arteries web into and veins web, and in that intricate system there, those would be our a capillary network. Once again, capillaries are a single layer of endothelium cells. Blood flows through tissues. From the heart, it flows through the aorta, and then it goes into arteries, which are smaller than the aorta. Then arteries get smaller and become arterioles. Arterioles connect to capillaries. Capillaries then connect to venules, which are very small veins, into bigger veins, larger veins, and then into the largest vein, the superior vena cava. And then blood is back to the heart. So that's also the process of blood flow from the heart to tissues and back to the heart. Arteries are, we're going to describe arteries. They're much more elastic than veins. They're larger for the most part, than veins. The larger arteries are more elastic. Medium-sized veins have a little more muscular, and they're for distributing. So that big elastic vein, like the aorta, it has it has to be more elastic. It's larger and it's more elastic because it's closer to the heart. So the pressure from the heart pumping on those big arteries, that's why they need to be more elastic, because blood is pumping through them faster and harder. And as the arteries branch out and become smaller as they go towards our hands and feet, then they can be a little bit more thin, and they because blood is distributing from there. And it goes down into the arterioles, which are very small arteries, and they connect to a meta-arteriole, which those are the connections to the capillary web or the capillary network. So we have really large, elastic, the aorta is large, it's elastic, and it has to be able to withstand a lot of pressure. And then as we get closer to the hands and feet, that pressure begins to decrease because the arteries and veins also get smaller. So if we look here, we see the heart is here, oxygenated blood is pumped out through the aorta. Those are those really elastic conducting artery. Then they get smaller and they branch into more distributing arteries. So they're a little more muscular because they have a lot of movement around them. And those are what feeds into our bigger muscle groups. Then they get even smaller into these little arterioles that go down and get smaller, like into closer to the tissues. And then you have these meta-arterioles, and those are the ones that connect to make the capillary beds. Then we have through gate channels where there's diffusion happening. And then we have the post-capillary venules. Those are very, very small veins. Then it comes back to smaller veins, still not going back towards the heart. Then veins get a little larger as we move closer to the heart. When we get to the vena cava, and then they dump into the vena cava, which is the largest vessel. Now, veins have valves, and we're going to talk about this again. Veins have valves because they don't have the same amount of pressure pushing blood like the arteries do. And so those valves flip back and open and close to prevent blood from flowing back. Just like in the heart, the valves prevent backflow of blood. The same thing in veins. The valves prevent backflow of blood. Capillaries are macroscopic vessels that connect arterioles and venules. Once again, they have a single, simple squamous epithelial layer that allows gas and nutrient exchange. There are sphincters, precapillary sphincters, that are backed by the meta arteriole, as well as that regulate the rate at which blood flows to the capillaries. We don't want it to be so strong that it breaks the capillaries. We also don't want it to be so weak that blood could clot in an area. So there's a continuous flow of blood through those capillaries. Then we have, once we leave those capillaries, like I talked about a while ago, once the blood is the oxygen is left, the blood from the artery, the deoxygenated blood goes to the venules, and then it goes into a little bit larger vein. Then it goes into the a bigger vein, and then into the vena cava. Varicose veins are very superficial veins that tend to be a little painful, and they can sometimes house blood there, but usually it causes a lot of discomfort. Okay, so this is systemic circulation. It's in a little bit of a different standpoint than we talked about earlier. Just remember, systemic circulation is where oxygenated blood goes to the rest of the body. What I want you to remember is that the upper part of the body, the head and neck, have their own system. They have specific vessels that just go to the head and neck. And then there are vessels that just go to the arms. There are vessels that just take care of the thorax, which is everything, the lungs and the heart. The thorax is where the lungs and the heart are associated. Then there's vessels that just take care of the abdomen, where your stomach, your large and small intestines, your pelvis, and your spleen are, and your liver. There are vessels that just take care of the bladder area, part of the kidney area, and then the legs. So we have very specific vessels in each area that take care of that. We're going to look at some images of that in a minute. Then we have systemic veins. We have veins that drain the same way. We have head and neck veins that have major vessels that drain into and major tributaries from the lower extremities that drain into the vena cava. So here's what happens. The head, neck, and upper extremities and the thorax drain into the superior vena cava. The abdomen and the lower leg and the legs and the pelvis, they drain into the inferior vena cava. So know everything from the diaphragm, which is below the lungs down, drains into the inferior vena cava. Everything from the lungs up drains into the superior vena cava. We have a specific portal, the hepatic portal, and it's very important that we have the hepatic portal system, because if our liver and our spleen, our stomach, and our intestines are very important, because that's where all of the absorption for nutrients and where our digestion is regulated. Also where our blood is clean in the kidneys and the liver, and things are processed. So it kind of has its own system as well, and that, once again, the abdomen, it drains into the inferior vena cava by the hepatic vein. Here's what I want you to know about fetal circulation. I want you to know that a fetus gets all of its nutrition and all of its oxygen from the umbilical cord that is attached to the placenta, and it gets all of its nutrition from the mother and all of its oxygen from the mother. And all the waste is distributed and removed from the baby by the mother. Remember that there are 2 umbilical arteries and 1 umbilical vein. That's all I want you to remember related to fetal circulation right now. We're going to skip that slide on fetal circulation because that's all I wanted you to know. Now we're going to talk about our great vessels. We have the inferior superior vena cava. We have our pulmonary arteries and veins, and then we have the systemic aorta. So remember, we have the largest veins the vein is your pulmonary, the largest vein is the vena cava, the inferior superior vena cava. Then our pulmonary veins and arteries are very important because that's how we have our circulation, how we keep blood getting reoxygenated. And then we have the aorta, which is the largest vessel in the body, and that gets blood to the rest of the body. So once again, there is an exterior image of the heart and the vessels. Now I just want you to see on these images how blood vessels go from the arteries go from the heart, and as they branch out and get further away from the heart, the vessels get smaller. We're going to look at them in a little more detail. As you can see here, there's the aorta, the descending the aorta here. But as it goes up towards the neck and the head, it gets a little bit smaller. And as we get down into the fingers and hands, the arteries become even smaller. So remember that. You do not have to learn the vessels this year. You have to learn them later, but not this year. Now you see the arteries in the abdomen, the ones that are around the stomach. You have the large abdominal aorta back here that branches off for the common hepatic artery. You have the arteries that go to the gallbladder, the stomach, the intestines there. So you can see they get smaller the further away they get from the aorta. Same thing here with the vessels of the intestines. I just want you guys to see how they branch off and get smaller as they go to the rest of the body. Major veins, your coronary circulation, those are your coronary sinuses or your coronary arteries, and pulmonary veins and your hepatic portal. Remember how important our coronary circulation is. That is the circulation to the heart. Those are our arteries, the coronary arteries and veins that are around the heart that give nutrition and oxygen to the heart and take waste away. Those are very important. We have mesenteric veins, which are in the abdomen. We have the hepatic veins also that are in the vessels. So we're gonna look at those and see how there's the vena cava, and you can see as you move further away from the vena cava and down towards the legs, they get smaller. You have specific vessels that go just to the head, and as they come up from the neck, they are larger, and as they get into the brain tissue itself, they get smaller. Same thing with the neck on down to the arms and hands. Once they leave the vena cava, they get smaller as they get towards the hands. Abdomen and legs are the same way. So we're going to talk about capillary exchange and what happens. And what I want you to remember, once again, take notes over what I'm saying, not exactly what the slide is showing. So know that when exchange is happening, that oxygen and carbon dioxide are being exchanged on the cellular level at in the capillary web, on the capillary network. Glucose and amino acids are being delivered. Also, lipids are being transported. So know that there's filtration and reabsorption. So nutrients and oxygen and carbon dioxide are being filtered in and out of that capillary network. Know that arteries do not need a valve because there is continuous pressure from the heart, the pumping action. And so there's always pressure. Now the veins don't have that same strong pressure because blood has already been processed and oxygen has left them. So it has more of a hydrostatic pressure. And so those valves close off so to prevent backflowing and clots from building. So when we think about important terms for circulation, we think about blood flow, blood pressure, and resistance. Blood flow is actually the pressure at which blood flows, the rate at which blood flows through the body. Blood pressure is the pressure the heart exerts on the vessel walls to send blood through the body. And resistance is the strength of the vessel itself. So once again, you're looking at that. Blood flow is the amount of blood flowing through the tissues at any given time period. The velocity of the blood is determined by how big the vessel is and how thick the vessel is. It mostly flows, it flows softly in areas that have the greatest width. So the bigger the vessel, the easier the blood flows through. Blood pressure is the force the heart exerts against the vessel walls. Blood pressure and factors that affect blood pressure, things that affect blood pressure, is how much blood is being pumped, the blood volume, how thick the blood is or the viscosity, the resistance of the vessel, and the elasticity of the vessel. So if there are things in the blood vessel that blood is having to push itself through, like a buildup of plaque or buildup of fat, that causes resistance. Also, over time, some of the vessels become hardened. And when they become hardened, there has to be more pressure and more force to push the blood through the vessel. Peripheral resistance is a resistance to blood flow due to the force of friction between the vessel wall and the blood. Resistance is affected by the viscosity or the thickness of the blood, the length of the vessel, and the radius or how large the vessel is. Other blood viscosity, once again, is how thick. The length is important, as well as the radius. Blood volume. If blood volume is low, blood pressure is low. If blood volume is high, blood pressure is high. That's all I want you to remember from that slide, okay? I do want you to know normal blood pressure for adults, for newborns, and for people who are over 70. So a newborn's blood pressure is normally 90/55 millimeters of mercury. Well, that's what mmHg stands for, millimeters of mercury. And I do want you to know millimeters of mercury. Adults, a normal blood pressure, 120/80 millimeters of mercury. For someone, an older person, a 150/90 can be considered, millimeters of mercury can be considered normal. So let's talk about what systolic pressure, because systolic is the first number, diastolic is the second number. So someone's systolic blood pressure is the peak blood pressure during heart contraction. So that is the peak blood pressure. And the diastolic blood pressure is whenever the atriums are relaxed and the atriums are contracting and filling the ventricles. So systolic blood pressure is when it's ventricular contraction. Diastolic blood pressure is with ventricular relaxation. Systolic is the first number, diastolic is the second. Okay, guys, that's it for vessels. Be sure you took good notes because you're going to have to know most of this, all the things I talked to you about. Y'all have a great day, and I will be back with you later.